Hello, this is Paul Chek. I thought I'd share a couple of tips with breathing and movement today. We're at the end of our theme this month at Chek Institute, which is breathing and movement. Now, for those of you that are interested, in my multimedia ebook, The Last 4 Doctors You'll Ever Need, How to Get Healthy Now, which is available from ChekInstitute.com, I do go through proper breathing mechanics, and I do show a very helpful technique for restoring normal breathing patterns. In my experience, about 90+% of all the patients I've ever evaluated have breathing pattern disorders. Doesn't matter whether they're athletes, housewives. Breathing pattern disorders are extremely common for a wide variety of reasons. Breathing patterns are altered in response to our mental, emotional experiences of ourself and our environment. The breathing pattern responds to our diet and lifestyle factors in general. But remember, one of the most common causes of a breathing pattern disorder, hyperventilation in this case, is the consumption of processed sugars, which acidifies the body. And because the breathing mechanism alkalinizes the blood and sugar acidifies the blood, as long as you're eating processed sugar, you're highly prone to hyperventilation, which will disrupt the balance of oxygen and CO2 in your body. And typically what you have is low CO2 relative to oxygen, which excites the sympathetic nervous system and leads to a racy mind and further facilitates a chest breather's pattern and a lack of abdominal use or abdominal relaxation as the diaphragm expands. When you inhale, remember your belly should expand for the first 2/3 of the breath, and the chest should only move in the last 1/3. And only now my chest is kicking in. On the way out, you just relax and let it happen naturally. So 2/3 from the belly, 1/3 from the chest. Practice breathing in without accessory respiratory muscle contraction, such as the upper trapezius, levator scapula. There shouldn't be any effort with the breathing, is what I'm saying. Now, with that basic information, breathing and movement together are very, very important. Many people try to do breathing exercises while sitting at their desk or thinking about it in their car, but if we don't get our breathing training down into the motor system to integrate it with our body, then we end up having a mental process that does not embody itself. That leads to short-term results with your practice. A very basic system to remember is that whenever your body is moving toward the fetal position, so if your arms are moving toward the midline or your legs are moving toward the inline, if there's internal rotation of the arms or legs or flexion of the body, that movement should be coupled with exhalation. If you're coming out of the fetal position, abduction away from the midline, external rotation and extension of the body, that movement should be coupled with inhalation. So what we want to do is begin a very basic practice of coupling breathing and moving together. So for example, let's just take the concept of throwing a ball, because we're all familiar with that. Pretend you're going to throw a ball. You would begin by opening the body, which is inhalation. So timing the breathing and the movement together so that the cycles of the movement and the cycles of the breathing are timed together. So my inhalation begins now, and my full breath ends right when my arm reaches the cock position, and then my exhalation begins as I begin to move as though I'm throwing the ball. When my hand stops and body stops moving, the breath should end simultaneously. Remember, as you're bringing the breath in, breathe through the nose, keep the tongue on the roof of the mouth to connect the meridian system and anchor the postural system. Belly is expanding. So you can use that. You can just use a simple breathing movement going in and out of the fetal position. So we start here with inhalation. And we end with exhalation. Key thing, tie the breathing and the movement together consciously. This takes the idea or the concept of breathing from being a mental construct and integrates it into the body so that the information is stored as body knowledge, not just head knowledge. It's very important to realize that many of the things that cause breathing pattern disorders are interpretations of our environment. Certainly many of you have had the experience of watching a high-action movie or a scary movie and found yourself holding onto the seat and your abdominals all tightened up and you're not breathing. So there you're seeing a psychological reaction to the environment, which if it happens frequently enough for any reason, be it stress from friends, parents, teachers, or even your own self-critical judgment of yourself, then the breathing pattern infuses itself into the body unconsciously. Most people don't realize what they're doing when they're watching a movie. But if they were hooked up to sensitive measuring instruments that looked at breathing, heart rate, circulation, sympathetic response, you'd see all sorts of stuff going on underneath the radar of the individual's consciousness. So when we practice breathing and movement together, we take the idea of how to breathe right that you read out of a book or that a therapist told you, and we literally embody it. And by doing that, the body begins to remember very effectively with enough practice. It usually takes about 350 to 500 repetitions to build a new motor program, but if you have a faulty program, it takes about 3,500 to 5,000 reps of corrective exercise to rehabilitate a program on average. So if you have a breathing pattern disorder and you're not breathing properly through your belly in the 2/3, 1/3 ratio, it means that you're going to have to contribute to your own training and your own rehabilitation with enough repetitions of breathing and movement in harmony to reestablish a normal functional motor program. So those are some very basic tips that can go a long way to integrating the mind and the body. And when you integrate the mind and the body, your sense of self expands to include your instincts or your inner feelings of yourself. And then your head is now integrated with your body, which allows you to be much more aware of what you need moment to moment and day to day to keep yourself healthy. Thanks for joining me today. Enjoy reading my book, The Last 4 Doctors You'll Ever Need, How to Get Healthy Now. I've got audios in there, I got videos, I got slideshows, teach you all sorts of cool things. And you've also got my book, How to Eat, Move, and Be Healthy, and many more. Thanks for joining me. See you soon.